Now, as the COVID-19 pandemic continues to grow, so are the parallels being drawn between it and another deadly virus that struck the globe more than a century ago. We're talking about the Spanish flu, which began in the spring of 1918 with one case in the state of Kansas. By the end of 1919 and the First World War, the pandemic had killed as many as 100 million people worldwide. An estimated 50,000 Canadians were among those who lost their lives. Well, for more on the differences and the similarities to the current COVID-19 pandemic, I'm joined now by author and historian Skip Desjardin from Connecticut via Skype. Thank you so much for joining us this morning.
Thanks for having me.
So, look, few people on both sides of the border were alive at that time. How does what we're seeing now with this outbreak and the response compare to the 1918 Spanish flu?
Well, it's similar in some ways that are frightening and others that are comforting. You just showed the numbers that are the frightening part, which was an estimate that there may be 30,000 Canadians infected by the time this wave crests. But 50,000 Canadians died of Spanish flu out of an estimated 500,000 who actually contracted it. So the numbers, the math of pandemics is often scarier than the science because of the exponential way in which things spread. The comforting part is that one of the things we learned 100 years ago was that social isolation, early diagnosis, treatment to the extent that you can get it when hospitals are overcrowded or even closed, are effective. And this whole concept of flattening the curve is one that was accomplished in good ways as the disease 100 years ago spread west across the continent, as a result of how traumatic it had been when it first burst forth on the east coasts of both America and Canada.
Now, it goes without saying that it was a different time. Medical advancements have changed dramatically. There's no question about that. But is there anything that now we can learn, governments can learn, Canadians, Americans can learn when it comes to health protocols and really how we take the next step?
Yeah, the first one is for government officials and health officials, more so government officials, to tell the truth. Tell people exactly what's going on. Tell them how to help themselves. Tell them how to avoid contracting the disease, how to care for themselves and their loved ones if they come down with it, when to see a doctor, when not to. That was not necessarily the case 100 years ago, where we were in the middle of World War I, and both America and Canada had a vested interest in people continuing to go to work, continuing to manufacture the goods and materials needed for a war effort. And so in the early stages of that pandemic, people were encouraged to go to work, which just infected even more people and made it worse. The other
Skip,
thing to keep in mind,
unfortunately, we have to leave it there. We are up against the clock, but we really appreciate your insight and a look back this morning. Skip Desjardin from Connecticut, thank you.